Chronic kidney disease is a progressive loss of kidney function. When kidney disease progresses, it may lead to kidney failure. The two main causes are diabetes and hypertension, but tests can show early signs of kidney malfunction. The Ministry of Health says the data on this disease in Belize is cause for concern.
It's worrisome that you have a lot of people actually early on having already evidence that there's a kidney malfunction, put it that way. It's not surprising that diabetes and hypertension are one of the, because it's been shown in the literature, it's been reported in literature that diabetes and hypertension are very important risk factors. We also know that diabetes is pretty prevalent in Belize. So it's not surprising in a sense. Probably what's surprising is that you can detect it from very early on that there's already evidence of kidney malfunction. So if we can address that from a very early on, when people come into the clinic and they detect already some risk factors, to do interventions early on.
Those interventions can help save patients from costly and painful hemodialysis or help to delay the onset of end-stage renal failure. And that is one of the goals of the Belize-Taiwan Cooperation on the Prevention and Control of Chronic Kidney Disease. As a part of this partnership, a little over 10,000 persons between the ages of 20 and 55 answered a questionnaire. From that number, 7,506 persons were screened. That report shows a higher prevalence of chronic kidney disease among females than males. According to the numbers, the disease is more prevalent in the older end of the age group of 50 to 55-year-olds. It also highlighted that risk factors and signs of the disease were more common among Mestizos, with the signs less common among Mayas out of all the ethnic groups screened. The two districts with the highest prevalence rates are Orange Walk and Corozal, with Orange Walk at 19.3%, more than double the prevalence rate of 8.8% in Toledo. The report also highlighted that, as expected, chronic kidney disease was higher among persons with diabetes, gout, and hypertension, respectively.
We can give you figures in terms of how many people with diabetes eventually develop the kidney damage, and hypertension, hyperlipidemias. We know, I think women are more vulnerable, or at least show a higher prevalence of renal damage. Up north, I think it was one of the areas that we identified where more people demonstrated factors indicating or information indicating that they have renal damage. Why up north? I don't know. We can guess at this point in time, but I think that's where I'm saying the data is still being analyzed to look at why more people up in the north demonstrate a higher.
Another big factor is obesity. The study shows that almost 50% of the respondents are obese. 1 in 6 persons between 20 and 55-year-olds has chronic kidney disease. The data also shows that persons who are obese are more likely to develop kidney malfunction than a person who isn't obese. So what can you do to prevent chronic kidney disease? Health officials say that you must drink more water, eat fruits and vegetables every day, limit sugar and salt intake, and get more active, run, ride, etc. Stop smoking and drinking alcohol, and those who have diabetes and high blood pressure must get more frequent medical checkups, but everyone should visit their doctors yearly. And now, with early screenings available and 9 specially trained medical professionals working within the health system in Belize, the Ministry of Health hopes that in the longer run, there will be fewer Belizeans suffering with kidney failure.
I will say that is exactly what we want to achieve, and that is something that we will be monitoring, because from the mere fact that we can identify risk factors, we want to develop educational programs that will try to convince people and sensitize people what are these risk factors: nutrition, a healthy lifestyle. But also we want to be able to detect people that begin to show signs. Remember when people come into the system that because they already require hemodialysis most of the time, it's at a late stage when really you can't do much to prevent them from going into having to go into a hemodialysis program. What we want to do is to be able to identify and that's where we have developed the health information system and trained our physicians to be able to do the proper tests early on, and the system itself will flag those who are showing, let's say, a protein in the urine early on, who are showing if they have hyperlipidemias. We know already that might be a risk factor. If they're diabetic, then we have to be a little bit more careful in terms of monitoring kidney function to target those individuals.
Reporting for News 5, I'm Andrea Polanco.